Hey, welcome. My guest today is Paul Gustafson, who's would you call yourself an expert in hypnosis? How would you describe
Well, certainly
yourself?
well experienced, almost 23 years of working in this field. Yeah, I've been in the trenches a long
And,
time.
and full disclosure, if you're willing to admit it, you're actually my cousin.
I am.
So just in case there's an investigation afterwards, people want to check our credibility. Yes, we are related.
That's right.
I inherited the good gene, but
Well,
okay, I'll cut that. So we were
you can't help yourself.
occasionally we talk about music and blues and metal and pop culture stuff. And at the end of our last conversation, we talked a bit about hypnosis. And it was kind of like what we call a doorbell or a doorknob conversation. Like the very last thing that gets brought up, I went, ooh, that was good. And you mentioned that therapists and other counselors sometimes make use of hypnosis to help process stress.
They do. Yeah. I wonder
And
how good a lot of therapists who are using hypnosis are usually what I would call dabblers, and they use it
okay,
occasionally. But
so they use it in their therapeutic practice, or do they use it for themselves?
in the therapeutic practices,
Okay, and that intrigued me. One of the focuses of the channel, since we're LeeBella coaching and counseling, is if there's anything I've learned in my 17 years in the field, is there isn't just one way to recovery. Traditional recovery tends to be very narrowly defined, abstinence based, and nothing against it. I have found that it doesn't work for, I'd say, a lot of people, and that hypnosis might be an avenue that someone might want to take a look at. So briefly, Paul, if you could tell us a little bit about what's your professional background? What'd you do before the
sure.
hypnosis?
I was an RN for 10 years. Prior to that, I worked in different manufacturing positions, but as an RN, I worked in a surgical thoracic unit, general medical floor, an angioplasty unit at Mass General Hospital in Boston. Worked 8 years as a home care hospice nurse, so I was in the trenches in the medical field for quite a while. Got burned out and had used hypnotherapy for my own personal needs when I was in college,
Ah,
and it came up in conversation as a possible career track as I wanted to be self-employed. So I looked into it. It seemed like a
oh,
good fit, and I ran with it.
that's a good thing. And a lot of the people that watch our channel, things that we deal with, it was the coaching profession in general. Because it's totally unregulated field. You don't need certification to be a coach. And both Julie and I do have issues with that. Are there certifications required? Does it vary by state? What are the
It does.
requirements?
It does vary by
Okay.
state. In the state that I'm in, Massachusetts, there are no regulations, which has blown me away for a long time. New Hampshire, just north of us, does have regulations. Many states will pick up and follow the regulations of large kind of governing bodies of hypnosis, like the National Guild of Hypnotists, and align themselves with those standards of practice. So no,
Okay.
Massachusetts, anyone can take a weekend seminar, get a certificate, and go into business. So it's very much a buyer's beware modality.
Okay. And you've been in business again for how
22
long?
years.
So, pretty good track record of credibility.
I think so. Yeah.
What intrigued you about hypnosis? What is it about it that you thought, I want to give up the glamorous life of a registered nurse and do this thing?
Well, it was profoundly effective for me in my dealing with public speaking fears when I was a student. And I was blown away by its effectiveness. I used it after that, self-hypnosis for my own meditation benefits. And when it came time to pursue a modality, I did some research into it, and I looked into a lot of the studies that were done on hypnotherapy. And there's tons of them out there. Nobody reads them, of course. But there are a lot of studies done, and which is what made me decide to take the plunge and open up to get certified, to learn the skills, and then start to see clients and help them. And it grew and grew and grew, and now it's hypnotherapy is now, we're still not regulated, but it's still significantly more mainstream. People I know, and the meditation apps are very helpful. People know about meditation. They know about that happy place, that meditative bliss. And the difference between meditation and hypnotherapy is hypnotherapy is meditation, a goal-oriented meditation. We go to that meditative state, and once we're there, we're able to create powerful separations from what clients are struggling with, and then to plant seeds that support what they want: freedom, comfort, healthy relief. And then they take the same process with sustainable relief as they took with the problem, which is repetition. Clients listen to sessions on a daily basis. I recommend a few months, and with that repetition comes a feeling of sustained comfort and confident relief from whatever their challenges are.
That's really intriguing stuff. Just so we can keep to the basics, what exactly is hypnosis, and what is the difference between hypnosis and a meditative state?
Well, as I said, with hypnosis, we are accessing the meditative state. We're going into that daydream state that we're people, as we all go in and out of every day in our day-to-day lives. We zone out, we daydream, we get lost in our thoughts, and a smaller percentage will actually pursue formal meditation for the cathartic benefit of being able to release a lot of emotional minutia that we may not be consciously aware of, and for the purpose of just generally feeling good and reducing stress. But with hypnosis, we take advantage of the fact that the subconscious, which is what we access in meditation, subconscious is open and active. That's that feeling of that daydream feeling is there because of the subconscious becoming open and active. And the kicker is, it doesn't know, the subconscious doesn't know the difference between what we're thinking about and what's real. So with hypnotherapy, we're able to go in and give the subconscious new information that supports easy, comfortable, happy, healthy, whatever the goal is. And then with repetition, the subconscious continues to pull in new information that supports what it thinks is going on out there, which is why change with hypnosis is often unexpectedly comfortable. Clients just find themselves heading on a new path. They find themselves not kvetching over the problem they were once overwhelmed by. They find themselves more routinely hanging out with what they want.
Interesting stuff. Are there any things that are more common than others? Like, what would be common examples
Stress
that someone would use
is the most
hypnosis
common.
to overcome or change?
Are you there? You froze on me there. Yeah. Most common, I think, most of the people I see are coming in with different forms of stress, worries, fears, certainly weight loss and smoking, but I do substance abuse, hypnotherapy. I teach those clients how to actually get high on hypnosis. We tap into endorphin flow. I help clients with bruxism, TMJ. I see a lot of clients with emetophobia problems, fear of vomiting, which is not at all uncommon. So it's people become trapped. It's about the pattern of thought in life. It's how we think and what we most frequently think about that dictates our life experience, for better or worse. And if our routine pattern of thought is worry, stress, fear, those patterns become rooted out of sheer repetition. And then that's kind of what they experience every day. So the subconscious is the hard drive. Give it information, it takes it and runs with it and automatically operates. Now that could be a wonderful pattern, a wonderful setup with patterns of music, with the arts, the patterns that you've developed doing your interviews, the patterns that I've developed explaining patterns. So it's all about patterns in life, patterns of action, thought, and emotion. So with hypnotherapy, we're able to help clients upgrade their routine pattern of thought around whatever they want to fix. So it's if clients are open, if they want to fix the problem, if they're open to chilling out the way that we do, and they're consistent listening to sessions, I tell clients that degrees of success are hard to avoid. Not guaranteed, but really close.
I like that. So it's hard to avoid success in hypnosis. Dude, you got my attention. You said that some people use hypnosis to get, to get high.
Yeah.
Can you build on that just a little bit? You said endorphin flow. Is it specifically endorphins?
Yep.
Or would there be other neurotransmitters?
Oh, that may be, but I definitely focus on the endorphin flow.
Okay.
I help clients take advantage of endorphin flow to get into self-hypnosis, how to get into self-meditation, very simply. Inhaling, every time we take deep breaths, the body stimulates endorphin flow. That's why runners get runner's high. That's why smokers think smoking relaxes them when nicotine's a stimulant. They're relaxing because we've taken deep breaths. So just to get into simple meditation, we'll take those deep breaths to establish endorphin flow. For sessions targeted on substance abuse, we go much more deeply into that endorphin flow and give them specific tools that they can use within the session to potentiate that euphoria.
Can you use hypnosis therapeutically for opioid dependence?
Well, it's a tough shot. I haven't had a lot of them. I do have some, but the byproduct of routine hypnotherapy, in addition to what I just said, is enhanced mindfulness. All of my substance abuse clients, we talk about the mindful moment before they use. You're asking yourself, do I need it? Do I want it? If you just want it, you ask yourself, is it good enough to pursue? If you need it, you ask yourself, can I put it off for a while, half an hour? So with hypnosis meditation, you become much more mindfully aware, much less compulsive. People who do something like this on a regular basis are very careful thinkers, unavoidably. They make better choices. So they're in a much better position to take the next best step forward. Opioids are tough. Opioids are real tough, and nerve pain is real tough to help people with. But
Are there any substance abuse clients you think that are more amenable to the endorphin flow, be that alcohol, cannabis?
I don't get too many people in wanting to quit cannabis. As it's now rising in popularity. Most of my drinkers are women who are drinking too much wine. I do have one that I'm working with right now who has kind of a significant drinking problem, coping with a lot of past abuse in her life and childhood, but which we're able to compartmentalize and create an emotional distance from. The great thing with hypnosis is that we don't need to go through and analyze and dissect, as a traditional therapist, all of the past problems in their life. We don't need to understand all the nuances of what they've been through. It has a wonderful broad brushstroke effect where you can suggest something like, moving forward, anything and everything related to what you've been going through, the worry, the stress, the overuse, substances, isolated, deleted, released, disposed of. Every time you press play and repeat the sessions that we do, the distance grows. You feel more empowered, more relaxed. And really my goal is to not give people the strength to push themselves away from the problem, whatever they come for. My goal is to get them so excited about what they want, and every time they listen to the session, they're continuing to define what they want and how good it might feel, that they decide subconsciously, instinctively, why not just trade up to something that's better? Rather than having to win the battle, they're just picking a new direction. They're given an opportunity to feel good, which hypnosis does, right away. And they tend to find themselves just letting go of the past more easily, more quickly. I don't know why mainstream psychotherapists aren't using this as their first line, but every time I get one in as a client, I'm always doing my best to convert them.
Like my brain right now is firing all sorts of different directions, because what you're describing is almost a form of memory extinction, where you have part of one of the many theories of addiction is we have attached a good memory or a good result from the repeated substance use. And if we're trying to do memory extinction, we're simply trying to break the positive relationship and association with that specific memory. I'm not a believer in that. That's very behaviorist to me. But you are describing, I think, elements of cognitive behavioral therapy possibly acceptance commitment. I'm with you. I don't know why more of us, yeah, I'm guilty as too. I don't use hypnotherapy. Let's say that you have convinced me 100%, and I've decided that hypnotherapy would be a good adjunct to what I provide. In very loosely, what would be the process for me to credibly, not like, I don't think a 1 day seminar is gonna cut it.
No, no.
What would be good directions, good
I
routes
would
for
I
someone
would
to
start
learn it?
out with a course through the NGH, the National Guild of Hypnotists, ngh.net. They're probably the largest. They are the largest, oldest, and probably most respected kind of governing bodies of hypnotherapy. And they do a lot of education. And a lot of these certification courses now, of course, are done remotely, so it's more convenient to get the information necessary. I don't know how they do the practical demonstrations remotely. I've been out of that loop for a long time. I've been in my bunker helping one client at a time and do a lot
Well,
of
you've been in
things.
your bunker.
What's that?
You've been in your bunker, but you also just recently consulted or worked with
I
Harvard
did, yeah.
University?
Yeah, Harvard University reached out. They had a bunch of nurse practitioner students, graduate level, that wanted to learn about hypnotherapy. So I was happy to help them, enlighten them with this disrespect. It's the modality itself has been aligned with bad movies and manipulative stage acts and entertainment forms of activity for a long, long time. So it's been used in the therapeutic office setting only since the 70s. A guy named Milton Erickson, he was a psychiatrist in Arizona, has started using hypnotherapy. So it hasn't been around that long in the therapeutic approach. But I think in the last 25 years, and certainly with the advent of Groupon and the Angie's List, there's more therapists out there who are getting more exposure, and certainly Google, which is what just been putting me over the top for a long time now. If you're respectable, you do good work, and people get great results, then you're going to be really busy in this field. So for you to transition would be to take a certification course, a general, when I did it, a general hypnotherapy course, an advanced medical or clinical hypnotherapy. There probably are certification programs on substance abuse out there. I'm not familiar with them. But it's easy, not easy, but you can get certified many different ways. So,
Okay, you brought. I mean,
but it's one thing to get It's one thing to get certified. It's another thing to be good at what you do. So,
amen. Can you say
Yeah.
that again for all the counselors and
kidding.
social workers out there?
and it's easy to get certified. The certification only gives you permission to start learning. And it took me a long time to hit my groove once I got certified,
Okay.
believe me.
You know, I've got a list of questions here, and I'm just going to have to go off of them. What? So you do the initial certification, and then you're deemed competent, right, to perform the service, more or less.
Yep.
But what kind of additional education or training did you need, or was it just a function of time?
Well, I dove right back into the advanced clinical or medical hypnosis after I got the basic. Coming out of the medical field myself, my intention was to lean more towards medically based hypnotherapy cases. So I got the advanced clinical, and then I've got clients for come in for irritable bowel syndromes, and I got certified in that. And so those are the three main certifications that I've got. I've dabbled a little bit took a course in metaphysical hypnosis, which is more the spiritual side. You're able to connect to spirituality with hypnosis. I'm not good at it. I didn't do much of it. I needed to make a living, and my nuts and bolts of doing that is certainly with smoking and weight loss and stress, which I've done tons of.
What is the effective difference between stage hypnosis, the stuff that we see in movies and wherever, and what your practice is? There, or are they the same thing? Just
Well,
used for
stage
different
hypnosis is
purposes?
set up this way. There's a few key components. The people who volunteer are the ones that don't necessarily mind clucking like a chicken in front of a room full of people. they're eager to get involved. The hypnotist will call a bunch of people up on stage and then does suggestibility studies, suggestibility tests, imagining that you've got a piece of lemon in your mouth, imagining you've got two arms out and the right one is going higher and the left one's got a bucket of sand, and when you look like this, these are the people that are most suggestible. The ones who aren't responding to these tests are asked to go sit down. The volunteers who are left on stage know that the audience expects them to cluck like a chicken. So peer pressure kicks in. And then you've got a hypnotist who has good technique, and these things fall right into place, and clients fall into a rapid trance, and they're eager to perform. So there's that. What we do in the therapeutic setting, the clinical setting, is to have specific, long, detailed conversations, intake conversations, to know who we're sitting with, what their problem is, explain the process so that there's a comfort level, so that they're actually able to get into trance sitting in a room with some strange guy for the first time who's going to do hypnosis. I have a basement office, they're coming into some guy's basement. So you got to break down those apprehensions and barriers by having conversations, and then we tiptoe into self-hypnosis, the breathing techniques, and learning how to do that even before the music starts for the formal session. By the time we go through 5 or 7 minutes of self-hypnosis, they're already in a light trance, and then we transition right into the formal sessions and get into a deeper induction, and then we get into the therapeutic part of whatever they came to fix. And one of the applications I do is a virtual gastric band weight loss program where clients are guided to imagine that they had that medical procedure within the hypnosis session, and they hear the sounds of the operating room and all of that. So it's a whole production, so it's kind of fun and very effective. So don't get me started. Once I start talking, I don't stop.
Well, and I'm hoping that means I can invite you on for more.
I'm sure that'll be great.
Okay. Another question that a couple of people knew that I was doing this. Does insurance cover hypnosis?
No, not in Massachusetts. I haven't had anybody tell me that they got reimbursed for many, many years. So I think if anybody's going to pursue hypnotherapy, they should expect to pay out of pocket.
Any sense? I know Massachusetts isn't representative of the rest of the company, but what would be the range, do you think, of what it would cost per session?
A quality clinical hypnotherapy, anywhere up to $250 a session.
$250 a session.
$150 to $250. Greater Boston area. That's the range that I'm giving you.
Can anyone be hypnotized?
Here we
or
go.
are there only certain types?
That's the $64,000 question. Can I be hypnotized? So, anybody who wants to be, who is open to the process of being guided into this meditative state, if they really want to fix what they say they want to fix, and if they don't mind chilling out the way that we do hypnosis, I tell them, like I said before, degrees of success are hard to avoid. To get into hypnosis, easy. Once we develop rapport, once we go through the simple breathing techniques, like I said, they can't help but fall into a light meditative state just by taking 5 or 6 deep breaths, right? We'll do that. They'll feel that effect right away. Hypnosis is very much a feeling modality. Clients come in, they don't know anything about me or the place or the process. We get into self-hypnosis first, and already they feel heavier, they feel calm, they feel like something's happening. The music starts, and then we start going deeper. And I'm guiding them, they got the Bose headphones on, and let me tell you that in 23 years, maybe in the first couple of years, I didn't know what the hell I was doing. There were probably a few that left saying, what was this all about? Nothing happened. But that doesn't happen. It hasn't happened for long. So I believe that everybody can be hypnotized if the practitioner wants to spend enough time explaining the process and putting them at ease. And I send out a lot of info prior to their first appointment so that they come in already knowing who I am and what I do, and so yeah, it's a good gig.
Are there any problems that hypnosis wouldn't be good for?
They say that epileptics can be problematic. I've never had an epileptic come in. I really don't know a lot about why that's mentioned. It was mentioned when I was in training. I see clients with depression, trauma, certainly the usual, pain, a lot of pain clients. So if people want to be here, and if I can get them in the recliner and get them around the concept of chilling, it's usually everybody leaves with a smile on their face. They connect right away to the feel-good aspect. They may not know if it's going to fix a problem, but they usually leave the office significantly or profoundly surprised at how relaxed they were. So that's what great the advantage of hypnotherapy when it's done properly. You get people's attention in a real good way right out of the gate. And then when they come back for that second visit, they know me, they know the place, they know the process. So that second visit is easier and deeper and more meaningful. One session builds on the next, and they're at home listening to the MP3 of their recorded session. It's just, they come back for the second visit and they feel empowered. They feel like they've got a tool. They feel like they know what they're doing. So everything that we do in the office is in their inbox before they're home, thanks to Dropbox. So.
Okay, because I do have to wrap up here soon.
Sure.
We've kind of touched on this. Is hypnosis? It's not accepted by insurance, but is it generally considered acceptable medical practice?
I get referrals from physicians. Yep.
Really?
I get referrals from therapists. Yeah, not as many as I thought coming in as an RN, but they're out there. I get them. I get gastroenterologists refer to me. Oral surgeons refer to me for my bruxism clients. I get therapists who I don't even know referring people to me. So
that's outstanding. Yeah. Final question: can you do hypnosis online, or do people have to be in the office?
I do remote sessions. They wear headphones like you have on, and I've got all of my sounds here, my mixing board with all of my nature sounds and music tones. That once the eyes are closed remotely, it doesn't matter whether they're in my office or at home. They have the same experience, and I'll record the session the way I would in the office, and they'll get it. So yeah, I don't do a lot. Certainly now that COVID's faded, I think. I don't do as many remotes, but I'm happy to do them, and the feedback that I get is there's no difference in success rates.
Oh, that's excellent.
Yeah.
That's excellent. Paul, is there anything I haven't asked you that you think
I have no idea,
people need to know?
I can't think of anything. You did a good job. It seems like you've been doing this for a while. You know how to ask all those important questions, and I really enjoyed hanging out with you.